Welcome back. You can take advantage of some very important health screenings for free. Cardiovascular Associates is offering free screenings for peripheral arterial disease. We have Dr. Ron O'Gorman with us here with all the information that we need. Thank you so much for being a part of Studio 10 today.
Thank you for having us.
All right, so first things first, we have to give people some general information about what we're talking about today. What is PAD?
PAD is, and a lot of folks have seen advertisements, public education promotions on TV, is peripheral arterial disease. The old folks, when I was a kid, called it hardening of the artery disease. It's when the arteries get stiff and calcified and then ultimately develop blockages, causing loss of circulation, causing loss of blood supply to the legs.
Now, the other medical term I saw that we want people to understand as well is claudication. What's that?
So claudication would be to peripheral arterial disease as angina would be to heart disease. It's the symptom people get when the arteries are blocked. So as you walk, you may develop pain in your calves that when you rest goes quickly away. So claudication is the cramping in the calves that brought on by exercise, relieved by rest.
And I added an extra F in there, claudification.
Perfect.
It sounded even fancier that
Exactly.
way. But it's actually
even better.
claudication, as we talked about. All right, so for these free screenings, what do the folks need to know about what's going on that you guys are providing?
So what we're doing in association with the national organization, the PAD Coalition, is offering screening and education about PAD. And what the screening involves is folks come into the office, they're given a very short, painless 15-minute exam where we measure the blood pressures in the arms and in the legs, and then we use the ultrasound machine to look at the arterial pattern, the arterial waveform, the way the blood is flowing in the two arteries of the feet. And so with that very limited test, we can determine that if there's a possibility of disease. If that test is negative, then there's greater than a 95% chance that the patient has no disease whatsoever.
Now, are there certain patients who should take advantage of this more than others, certain age groups, demographics, all that kind of stuff?
It's a very common disease. It's estimated that 1 out of every 20 people over the age of 50 have PAD. It is associated with the same risk factors that cause people to have heart attacks, cause people to have strokes, any of the arteries. The blockages, the risk factors would include age, but high blood pressure, high cholesterol, diabetes, family history, and then folks that are inactive or not as active.
All right, so very important if you meet any of these things we're talking about, to come on in and take advantage of this free screening. So there we have it on the screen. Tell the folks when is it, where is it, and how they can participate.
So the screening will be tomorrow and Thursday. We'll have screenings in Mobile and in Fairhope. The thing they need to do is to call the office. It's 300-2240, so 300-2240. Make a time slot, and it'll take about 15 to 20 minutes when you come.
Anything else we need the folks to know?
I think that's great.
All right, so come on out. All that information we just talked about will be online as well, so you have a place to go to get all that information on the Studio 10 tab on fox10tv.com. Thank you so much for coming in today.
Thank you for having us.
Appreciate it. Chastity.